I talked with Katina this morning. If you can set aside her a thermometer.
Okay, I will do that.
Are you all providing thermometers or?
We have one if you would like one.
Well, we have one now, but I didn't know that you were.
Well, we were able to pick up a couple of the thermometers.
Mhm.
So if you would like one, we can put your name on it.
I think we're just a small center, so I think our one that we have now is
Okay.
okay. Maybe another center would need it.
How are you doing with gloves?
Good. Yeah.
You good? Okay.
Yeah. We're good on all supplies. And now
Good morning, Miss Paula.
I feel like I'm the only one not at work. I'm sorry.
Miss Paula, give me a call later on today. Miss Paula, have you opened up yet?
No, we're gonna try, and we're shooting for June 1st.
Okay.
Yeah.
Okay.
Still a little nervous, but we got the game of life.
Yeah. If you can you give me a call later on today?
Let me I'm in my look. This is one of my babies. Say good morning.
Good morning.
Say good morning. He don't ever go home. He Miss Sabrina, I think I already have your number. So yeah.
Give me a call.
Sabrina, are you from DHR?
Child Care Central. Yeah,
I'm
program
not sure if I've
director.
ever seen you before.
Where are you located?
Miss Marcia's.
Say that again.
Miss Marcia's Child Care Center.
And where?
It's right there in Huntsville.
Okay. Yeah, I come to Huntsville, what is maybe once or twice a month? Yeah. I work out of the Talladega office.
Oh, okay.
Sorry, guys.
It's not showing up. To me, it's too early. It's too early. The kids stay at home. You just have 8 kids. in my class, yeah. And I think maybe it was like some, oh, yeah, I want kids. Well, it's one of the kids that do it, you know. Yeah, it was also. Yeah, I have my first, I've been having some things done here and there. It's the second one for this week. My father went in it. Mine, I don't know how, but I've been eating. Eating. But you know, like this, you know, my school. I've been measuring my stomach. I took this one on my wheel and pressed it. I put paper roll, placed it. I put my set piece. I don't know what's all of them. I got it for a break time. So I don't know if it's like super interesting. Oh, really? So I'll tell you what. You know, you just can ask me. He's on a call.
Oh,
He's on
really?
a call.
Oh. Mm-hmm. And once we went on that, my daughter sent me this thing that said that you got Medicaid, if the household got Medicaid, to put your EBT card on the state. And if you, I never get that on my daughter, I just got on my son. And if you don't have Medicaid, you'll receive a call on Sunday, I think it was the 23rd. What? See, the letter's supposed to be coming out, and like I said, I ain't heard nobody else. It's like, maybe they got away along with kids, something, because they just skip the list from school. I don't know why they really sent you out a letter. All you have to do is sign the letter and put your birthday. That's crazy. And it might have stopped because they might have just got the list from the school, or they could get that through USCU though from the school. And I don't know. Good morning. Good
Morning.
Good morning. Sabrina, are you trying to keep a list too?
Yes, oh, I'm sorry. Did I sign Teresa's? Okay, he's not here for mine. That's all that's been turned in. So if we don't get it today, it'll be next month. Yeah. I didn't hear you, Stacy. I'm sorry.
Are you trying to keep a list too?
No, if you can do that, or
Yeah, I've got it. I was just making sure.
okay.
I'm in. Okay, I'll call you back.
Yeah, taking.
I see that. Good morning, Stacy Sorrell.
Good morning.
How are you?
I'm great. How about you?
I'm good. I'm good. Glad to have you with us today. We're going to get started in just a minute or so.
Okay, sounds good.
Good morning, Miss Candace Keller.
Good morning.
How are you?
I'm well. How are you?
I'm good. Glad to have you.
Thank y'all for having me.
Oh, anytime, anytime. All right, I have 10:01. Good morning, everyone, and welcome to our Directors Forum this morning. We are going to be dealing with the new normal. This is a question and answer session. I am Sabrina Robinson. I am the Program Director for Child Care Central. We are located in the Talladega and Huntsville region, and I just want to welcome everyone this morning. We still have people coming in. We are, let's see, trying to get everyone into the session that wants to be here this morning. We've already had some questions to come in, and we are going to deal with those questions this morning first. And then if you have other questions that you would like to ask, I will let you know who's on the line that is representing our state partners that we can forward those questions to. I see Miss Stacy Sorrell is here from DHR. Good morning again, Miss Stacy.
Good morning.
Miss Candace Keller, she is representing our subsidy agency out of Montgomery, Alabama. Good morning.
Good morning.
Do we have, is Sandy Powell on yet? I have not.
I have not seen her come in, Sabrina.
Okay. We're waiting on Miss Sandy Powell. She will be representing the Alabama Department of Health this morning. And we also have some other ladies that will be joining us from DHR. Soon as they come on, I haven't seen their name flash up yet. Miss Angela Brogdon, Zoe Moore. I will let you all know. Okay.
Sabrina,
Yes.
in here with me, I have Chandrea Robinson and Karen
Awesome.
Moore.
Awesome. Well, good morning, ladies.
Good morning.
They're trying to hide.
Yeah, they don't want to be on this camera.
Okay, well, let's go ahead and get started. Stacy, if you can go ahead and move the PowerPoint to our first area that we want to deal with this morning. It's our parents. There are a couple of things that was brought to our attention. Should parents, visitors be prohibited for entering the facilities classroom? Should parents be required to wear masks, shoe coverings, and then instead of signing in and out, could the use of swipe cards only during this time for reason to lessen spread and contact time with parents?
Yes, it is. It's under virtual.
Okay. So I'm going to turn this over to Stacy and to Candace because I think it will fall into both of those areas.
I think the first question then was, I'm sorry, I can't hardly see it. Should parents / visitors be prohibited from entering the facilities or the classroom? No, you cannot prohibit parents from entering because there's a minimum standards that says that parents have to have access to the children at any time. So you couldn't, prohibit them from coming. You can encourage them and explain to the parent why it's best not to at this time. But if they insist, you can't prohibit because then you'd be in violation of the minimum standards. I think we're just going to have some open conversations, you will, with your parents, just letting them know that you're not trying to hide anything, that this is for the protection of the children as well as their own protection, and then just explain to them why you're trying to limit visitors into the building at this time. But again, you just can't prohibit it. The second question had to do with, should parents be required to wear masks and shoe coverings? There's not a minimum standards that requires any parent to wear a mask or any type of shoe covering. That would be based on your policies as well as meeting the guidelines suggested by the requirements that were in the order. So they would have to meet the order, and it does say that all teachers or adults have to wear a mask, but that is not a minimum standard requirement, but that is a health requirement. So what my staff would do if they came in and they observed teachers without their mask on, they would just, that would not be a deficiency for the facility as far as minimum standards, but they would have to let the health department know that your center had staff in there without their mask Like I said, again, that's not a minimum standard, but that is a part of the health. About the signing and out, Candace can address the swipe cards, but as far as it is a minimum standard that children be signed in and out daily by the parent. They can do that a lot of different ways. I mean, the parent, they could set up a area outside at the front door where the parents didn't have to come in. They just get the children to the front door and then they could sign them in there. I've had a lot of centers tell me that they have the parent to bring their own pen so that they don't share pens, you know, or they put out some kind of disinfectant at the table so that the pens can be wiped down. You could supply gloves if you wanted to, but you would have to have them signed in daily. You just have to come up with unique ways to keep the area clean and disinfected, such as them providing pens or wiping the pens.
Okay.
And good morning again. Regarding the request for more swipe machines, generally it was said that it was 50 children per swipe machine. This is something that we would have to discuss with leadership as far as in the potential cost to increase that number of swipe machines. However, I don't see that it's a bad idea. It's just a matter of do we have the cost to the money to fund that at this time.
Okay. Are there any more questions about parents at this time?
I have a question. Do the parents need to sign a waiver, you know, stating that they know the kids could catch it, and you know, I know some other centers were using a waiver that they had signed. Copy of it. It's a assumption of risk waiver.
That is not a minimum standard requirement. That would be your own policy.
Okay.
You know, if you felt like that's the best thing to protect your facility, that's a decision each owner of the daycare will have to make on what's best for their facility. But there is not a minimum standard required. No, it's not required that anybody signs a waiver.
All right.
Okay. Any more questions about parents? Okay.
No, I don't.
All right, let's move on to children. What is the staff-child ratio and napping ratio? How should we prepare children to wear masks as a new normal? And then how do you keep children social distance in the classroom?
The ratios are not changing than what they are in your minimum standards right now. Your daytime ratios would still be the exact same that are on page 24 in the minimum standards book. And then your nighttime, your sleeping ratios are the same as they are on page 25 in the minimum standards. So this has not made any changes to our child staff ratios at all. So it'd be the exact same ones that you currently have in your minimum standards. The second question on how should we prepare children to wear masks? That is not a minimum standards requirement. That is not even a health requirement in the health code that the children wear masks. I know it was suggested in some guidelines that they provided, but again, that's not a minimum standard requirement, so that would not be anything that my staff would be enforcing, the use of masks on children. How do you keep children social distance in a classroom? Again, the only thing that was addressed in the order pertaining to social distancing was discouraging parents to congregate in an area like for instance, in your sign in and out area. You don't want them all standing around together. congregated, you're supposed to break that up and discourage that. But there's not anything in the order as far as what's mandatory that children be social distance. There was some recommendations again in those guidelines that were suggested. But again, those are not going to be enforced, and they would not. If we saw children not social distancing in a facility, that is not something we would report to the health department. We would only report to the health department if we saw your parents not social distancing.
Okay. What about at lunchtime? Can they sit next to each other, or how would we have to spread the kids out during lunch, or?
Again, I don't know. Did you have anybody, Sabrina, on the call from the health department?
Only person I invited, Sandy Powell. Is she on now? I have not seen her name.
Okay. Again, you know, and I hate to keep telling you that we don't have a minimum standard that says, I mean, so there's nothing in our standards that would prevent the children from sitting together. You know, so we can't do anything that would prevent you from keeping the kids together. But I don't know, and I'm not even sure on as far as from the health department, what their guidelines are as far as the children at the table. I would discourage the use of them sharing utensils or doing any self-serving of food, you know, from the same container. If anything needs to be served, you know, the parent should do that. But as far as that's not a minimum standard, that would just be a suggestion that I would make to you as far as that. But we don't have anything as far as keeping the children separated during the mealtime.
Any other questions about the children?
I have one that the cap off is 11 in a room. Is that 11 children plus your staff, or is that 11 altogether?
Yes, ma'am. That is not in the current order. So the current order that passed last week did away with that 11. So now the only things that apply are those 3 things that were left in the order. And that's the part about social distancing of your parents, the sanitation of your, taking reasonable steps to keep everything sanitized, and then the facial coverings for your staff. But the 11 is no longer in the order.
Okay.
So now if your room measured for 15, then you could have 15 in that classroom.
Okay. I just got notice that Sandy Powell is having technical difficulties. Let's see if this is her. There was a question. I just lost it. Let's see. So you can have all your regular students.
What now?
Someone asked, so you can have all of your regular, I guess, children in your classrooms now?
Right. So if that classroom measured for 18, then you can have all 18. We never said that it could only be emergency personnel staff. That was never a requirement by us. So, I mean, you can service any of your parents that are wanting to bring their children back to child care, as long as you're meeting the capacity that you are licensed for in each classroom.
Any more questions about our children?
Is everyone combining at nap time, or not? No combining at all?
You mean like combining groups of children?
Yeah. Well, you know, like I only have like 2 infants coming back this week and 2 or 3 of my older infants, and they're in 2 different rooms. And I wondered, can you combine that room, or is it best to keep them both in their own room and just have one
Right.
teacher with
Uh,
each?
We don't have a minimum standards concerning that. The only thing that, we say is that children under 2.5 could not be grouped with children over 2.5.
Right.
So as long as those infants were all, of the under 2.5, then they could nap together as long as you were meeting the appropriate ratio for that age child. But there's nothing in the minimum standards that would prevent you from sleeping those 4 children together as long as they were all under 2.5.
Mhm. Well, what about if it was just like, if you wanted to just combine for the whole day, just because that's all you had in there? But is it safer just to keep them in their own classroom in case someone gets COVID, or,
That's probably more of a health department question. But as far as us for minimum standards, as long as they were like in the age group that they could be mixed, then you could mix them and still be meeting minimum standards. Now, I don't know whether the health department encourages that or not.
Yeah.
I'm sorry. Hopefully she can get on the phone
Sandy's
and answer
on.
some of those questions.
Yeah.
But for licensing, you would be fine as long as there's nobody over 2.5 years of age.
Sabrina,
Combined with under
Yes.
2.5.
there are quite a few questions in
Yeah, I
there.
see 'em.
Can I just say that if you have a microphone, please say the question, because it's hard for us to keep up with the questions on the chat. So if you have a microphone, please just unmute it with your space bar and ask your question. But one of them is, we do a car rider line for parents so they don't have to walk in. Do we need to change that?
To right now, in order to meet the minimum standards, children have to be escorted into the building by either the parent, the guardian, or another designated person. So for them to meet meeting standards in a car line, I assume that in a car line, the staff person is coming to get them. I'm not sure on that. But if it's a staff person, the parent would have to designate on the pre-admission form or write a statement that can be attached to the pre-admission form saying, I designate this staff member so-and-so to be able to, bring my child into and out of the building as the designated person. And then they could do it. And in fact, at that point, it actually gives them, if they're considered the designated person, it also gives them, if they're on the pre-admission form, the right to sign that child in and out as well. But like I said, that parent would have to designate that staff person on the pre-admission, or a statement that could be attached to the pre-admission, giving that person the authority to do that. So it couldn't just be a general permission given anybody in the facility. They would have to name who they're given permission to do that.
Can I ask a question with regard to subsidy in that? So let's just say I get designated permission as Kim to sign in my students. At this point, I know we can't be sending in any forms that are going to be correcting absences, et cetera, but we send in attendance sheets. If they all say Kim Knott under other people's children's names, is that going to be accepted from a subsidy point of view?
Stacy, is it okay that the staff worker accepts that? Well, I guess the first thing is there wouldn't be a reason at this point to send in for payments for adjustments because we're not taking them right now. So I don't see that it would be a problem now. It would be if license says you have the permission to sign by the parent and you are sending in adjustment, then you need to attach that permission slip that you sign, on behalf of the parent in order for us to process that. But however, right now we're not taking adjustments during this time, so there really wouldn't be a reason that you would need to send one in.
Yeah, I understood that during this time it wouldn't be, something that's being done. My question was more moving forward. if you do get that kind of a situation where someone has to be picked up from a car and you're the designated person. As long as I know to attach that form, I'm good. Just wanted that
ma'am.
in.
Yes,
Thank
ma'am.
you.
I'm sorry, I'm gonna have to start wearing masks in the building.
There was a question, does napping have to be 6 feet social distance or still remain the same as before?
For licensing purposes, we just say you have to be able to walk around all four corners of the cot. So as long as you can do that, we don't have anything saying that it has to be 6 feet. It's just that you can safely walk around the cot without tripping or falling. And then you have to have the 2 feet of space, of course, between the occupied cribs, but we don't have anything requiring the 6 feet of space.
Okay, and then someone asks, was stated, I have heard that some centers have low enrollment. So how will that be with subsidy payment? Parents are still a little worried about sending their children.
At the moment, we are continuing, I'm sorry, can everybody hear me still? At the moment, we are continuing the 50% sustainability payments. There has not been a decision made that we would stop it at any time. However, providers will get notification that when that plans to stop. And I will assume that at that time, we'll probably reinstate the absentee policy as well, that they get the 5 absences per month.
Should children have individual materials such as crayons, pencils, scissors for daily use?
Again, there's not a minimum standard that says it has to be individual. I do think that's a good idea this time. But there's not a standard that says you've got to do that. But I don't see any reason, it sure won't hurt, and I don't see any reason that it shouldn't be a good practice to do that. But like I said, it wouldn't be a deficiency if you were not doing that.
I see that Sandy is on. Do you have any recommendations for that? Sandy Powell. You are muted, Sandy. Can you unmute your phone? Can you hear me, Sandy? Okay. Someone is on for public health. Can that person answer that question? There was a statement, I am on from public health. Social distancing 6 feet apart is always in effect.
That's Miss Sandy at Public Health.
Okay.
Does that mean during lunchtime? If the public health person can hear me out, I would like to know how are we supposed to spread the kids out at lunch or?
Okay.
I think we need a little clarification on that because obviously it's not going to be a problem or a deficiency. Our licensing, but it's something they would need to report if we are not keeping children as well as grown-up 6 feet apart. And is that at all times?
Okay, I'm still waiting for Sandy to answer.
Like I said, now it's not, as far as licensing, it's not in the order. This is what the order said: employees shall not knowingly allow parents or other guests to congregate within 6 feet of a person from another household. Facilities shall also take reasonable steps to prevent parents or other guests from congregating in lobbies, cafeterias, and other common areas. So for us, like I said, we would only report if we saw parents or other adult guests that were congregated or they weren't 6 feet apart.
Okay, thank you so much, Stacy. If she does come on, then we can also go back and get more clarification on that point right there. Stacy, can we move to the next slide? And this one is dealing with providers and directors. Are background checks being done yet? And then how? First aid, CPR trainings by Healthy Child Care Alabama. Are they also taking place? And then how do we practice drills and keep social distancing?
Background checks, I know there's a lot of the offices that are closed. I haven't heard lately. There's one open, I know for sure. Somebody told me in Clear. Yeah, I know there's one area that is open. I don't know. You just have to call the places that are, you might could even check with criminal history to see if they're aware of which areas are open as far as for the background checks. I did hear somebody say somewhere, and I want to say it was Calera that was doing these background checks because it's kind of centrally located, that they were still open and doing them. But I don't want to say anybody else because I'm not sure, but I would think maybe if you contact Office of Criminal History, they might know of agencies that are open doing that. So that's what I would encourage you to do on that. First aid and CPR training by Healthy Child Care Alabama. I don't know if they've started that back yet or not. I know we were on a conversation with them a week or so ago about that they were going to do something possibly to extend if anybody's card had expired, you know, to give a time frame for maybe possibly an extension on that. But I don't know if they got that finished or not, but that would be Healthy Child Care Alabama. But I'm not sure if like American Heart Association or any of those agencies are doing CPR and first aid yet. I mean, if we came to your facility and you were out of compliance on that, it would be a deficiency, but we would work with you on setting a time frame because we know if you can't get it, you can't get it. And we would not do anything as far as toward your license, you know, that would be any form of corrective action other than to try to we would have to write it, and then we would work with you to figure out when is that you might be able to get that corrected. But we do understand that that would be something that could possibly be pending for a while, and we do understand that, and we will work with you on that. As far as practicing drills, that is not a minimum standard requirement as far as how often you practice those drills. It just is quarterly. So, you know, other than quarterly, you might want to talk, if you're talking about fire drills and stuff, the fire department might have some suggestions for you on how to still do those. You know, maybe you could do them one classroom at a time, or I don't know, they might give you some suggestions on that. But like I said, it's only quarterly, so it's not going to be something that we require very, you know, real often in the standards. But I would just encourage you to reach out to maybe your EMAs and your fire departments and then see how they feel like you could safely, do they have any recommendations on how to safely do that? But as long as you're doing it at least quarterly, you will be meeting that minimum standard requirement.
Reference to first aid, I know that Karen Cobb with Public Health has already recalled and rebooked the ones that the first aid and CPR that we missed. And she's already starting to rebook. So we've got that for June. So some of them are starting to move.
Okay.
Can y'all hold 1 second? I've got a question. Sandy Powell from the health department can't speak through her speaker, but she's wanting to speak through my speaker on her phone. Okay.
Okay, can everybody hear me?
Can y'all hear her?
Barely.
Now how about that?
That's better.
I'm so sorry. I apologize. It's saying it's not recognizing my microphone or my audio. But I would like to go back to the social distancing. Our guidelines at this point is to do everything we can to social distance at 6 feet. And no, that's a real challenge. And I think we're gonna have to look for some good ways of doing that, and then sharing that with some of our providers. One of the things that I'm going to do when we go back to CPR and first aid, I hope to be able to mark where the mannequins will be 6 feet apart with painter's tape, because we have to adhere to that when we train as well. And that would probably limit the number of participants that we're going to be able to accommodate with first aid and CPR. Did y'all hear me?
Yes.
Okay. Were there any other questions that I missed?
The question about can they sit next to each other at lunch? And also I had a question, if some centers are already open, how are you doing your teachers' lunch breaks? Are they allowed to still leave the building and come in and out for lunch?
Call from Chief Redmond.
Did you hear them?
The social distancing in the lunchroom?
Yes.
That's going to be a challenge, but social distancing is going to be throughout every activity you do in the daycare setting. One of the things that I've been reading a lot of that guidance from CDC and trying to figure out and what it means to us. I'm really hoping we will get some updated ones soon. But it's talking about staggering the lunch times, which I'm sure you probably already thought about. But at lunch, that is going to be a challenge. Sabrina, did we send out those CDC guidelines?
Yes, all of the CDC guidelines that you sent to us, we have linked them to this session. If the directors are coming through our e-learning site, they will have access to them. If you just came through Zoom and you would want a copy of that, please just send me a message. You can do it in chat, and we can get those handouts out to you.
And you're always welcome as you're going through it to give me a call and we can talk through some things. I think that there are going to be some challenges with social distancing.
Has there been any change in any kind of food preparation for class 2?
No, not that I'm aware of with public health.
Okay.
Somebody was talking just a minute ago about our nurse consultant Karen Cobb scheduling CPR first aid. Okay, when is that scheduled for? Can you tell me?
Sorry, had to get my mute. I think it's later in June. She said she may not be able to do it, but she did get us on the count.
Okay. And I know everybody is tired of hearing that, and we're tired of saying it. We've been asked at Public Health to wait until June 8th to make a decision based upon what COVID's doing at that time. And as y'all are all aware, it is just the cases are going up and up and up every day. So June 8th is when we will reassess. We are preparing to be ready to go back into with the providers July 1, and we will have PPE as well. So we'll have a different system of doing that. But we are hoping, as far as first aid and CPR goes, that we can get back out there on July 1.
With reference to the person asking about staff and leaving for lunches, Jeannie, is it?
Yeah. Yeah.
Hi, I'm Kim. We're letting ours leave and come back. We have about 50 students at our one school and about 20, and we've been open this is our 4th week for the one center and our 2nd week for the other. So it's slowly building, and we have been letting them go out, but when they come back in, they hand sanitize. And we're debating some other protocol because, yes, the numbers are going up. And we're experimenting with the whole social distancing. I'm going to tell you straight up front, 2-year-olds and toddlers, almost impossible, almost impossible. But one of the things that we're trying different things in each classroom, and one of the things that we're about to try now are large hula hoops because they're easy to clean. And then each child has a hula hoop. They place it on the floor. The things that they play with are theirs inside of the hula hoop. As long as they stay in the center, the hula hoops keep them pretty close to like 5 feet apart. If they come to the edge, of course, they can touch each other if they do bump them, but they're also easy to clean. So we're going to try that. Not entirely sure it's going to work because I think they're going to want a hula hoop, but we'll see if that doesn't like create distance rather than having to constantly put tape on the floor and shoo people. They have a little bit more of a freedom to take their hula hoop and go do something. 2-year-old classes are combining with specific bins for each child so that what they have in their bin is theirs for the day. So if you're the potato head kid today, you get to be the Lego kid tomorrow, but those are your things. So we're trying a few different, like each room's kind of trying and experimenting a couple of different things to see what's going to work. So I'll let you know if the hula hoops kill anybody.
Like a good idea.
Mm-hmm. That is a good idea.
Any other questions? There are some questions in regards to subsidy. I think some of it we have touched base on, but I want to go ahead and read through those again. Since enrollment is low due to the fact of social distancing, all numbers will be low for enrollment. How will the difference be taken care of in subsidy? And another one for subsidy was if there were children that had already attended the center but hadn't showed up in the system yet because of closure, will we be able to obtain back pay on those situations?
Okay, for the first question, we will continue the sustainability payments, the 50% of their enrollment. Therefore, those will continue. You'll get a notice before we discontinue that service. As far as if the children were had already attended the center but hadn't shown up in the system yet before closure, we will be able to obtain back pay on those situations. That's on a case-by-case basis. If we can just get the providers to contact us, contact me, so we can discuss that, so we can get the details, because it may be something that the children are already there and you're being paid the sustainability payment for the children, because the sustainability payment began based on the enrollment of April 20th to be exact. So we know those children should have, they may not have shown up in your system before you closed in March, but they would have shown up in your system before we started the enrollment of the 50% enrollment. And therefore we saw those children we would have seen those children in April. But again, that's on a case-by-case basis. Sabrina, if you have the opportunity to put my info up as far as my email address, my telephone number for the providers, so that they make contact with me.
Okay. Question, hours of operations will have to be adjusted to ensure enough time to screen caregivers, children, and parents to clean properly. Is this feasible? And then how long will we continue to get paid half on the children who have not returned to the centers?
I'm sorry, was that the first part for me?
Hours of operation is talking, they're asking, they're stating first, hours of operations will have to be adjusted to ensure enough time to screen caregivers, children, and parents, and to clean properly. So is that feasible? Or will there be an issue with that?
I'm not sure if the question is a licensing question. You're talking about that they would have to go beyond their license hours? Is that what they're referring to? Like if you're licensed from 8 to 5, they're saying they might have to come in at 7 and stay till 6, or I don't know. As far as the license, they can't have children. They can't care for children other than the hours that they're licensed for care. But as far as cleaning, that doesn't pertain to staff coming in, getting the facility ready, or staying after to clean up and things like that. It just pertains to the hours that the children are cared for. So as long as they stay within the hours that the children are cared for, they can come in and leave as late as they need to. It's just the children's hours that we're concerned about.
And the other one was, how long will we continue to get paid half on the children who have not returned to the centers?
And again, for right now, we don't have that information. It's on as the governor gives us more information as far as in how closures has things lifted throughout the state, then we have to make those decisions at that time. But I rest assured that we will give notice before we stop those payments.
And is that just for subsidiary?
That's the only thing that we're paying for is a subsidy. Okay. And as far as the healthcare provider subsidy, that is different. That is going to be, those families will be eligible to receive payment for their children until July 31st. If the parents are income eligible, they can continue on the regular program. But as far as right now, they're receiving, right now the program started April 20th and will pay up until July 31st.
Okay. Any other questions about that?
I have a question about subsidy. If I had a kid that has returned like last week and this week, but maybe next week the parent work doesn't have available hours, so that kid won't be coming. The work's doing a week by week basis on parents. So because that card has already been scanned for the past 2 weeks, well, 2 including this week, I know we'll be getting full pay. But next week, will the system just automatically go back to the half pay? It didn't, like, once you start scanning, like a kid come back, that's going to mess up, do a glitch in the system or anything?
No, ma'am. The attendance is just the attendance. It's when the child comes. The 50% enrollment is based on your enrollment as of April 20th. Okay. So that's just regardless of what you'll get that regardless. As far as in his swiping, the parent can can bring him regardless whether she's or he is working or not. If she wants to continue, because she's not going to lose service. We're not terminating anybody if they're not using the services now, because we understand some don't want to use the service. They don't want to bring their children to the child care centers, or they're not working, so they're spending this time at home with their children. But we're not terminating anybody's services based on that.
Okay. All right, thank you. And I was going to say too earlier about somebody had asked about the fingerprinting. We're a fingerprinting site. We're in Etowah County, which is in Gadsden, and I'm doing fingerprinting after hours, as long as people come in wearing a mask and they have an appointment. But they'll need to call the center to schedule that. And it's 256-442-4960.
Okay, any other questions?
Would you repeat that number again, please, for the fingerprinting?
Yes, it's 256-442-4960. And that's at Nakalula Academy, which is in Gadsden. And the county is in Etowah. But they'll just need to come by themselves, wear a mask, and call in advance. So the appointments would be like 5:15 because we close at 5, because I want to get all the kids out of the building before I bring anybody in for that.
Thank you.
You're welcome.
There was a question on the chat. How can we practice social distancing in the nursery with handling babies? Should we confine babies to their designated cribs?
I guess that's a question for her. I think that's a question for the health department. We don't have anything in the standards on that.
Okay.
Would that be allowed in
Really haven't,
with DHR if?
yeah, hear me.
Would they be allowed for, with what, with DHR?
Yeah, because I know they don't want them to sit in their beds too long.
Right. I mean, you still got to meet the minimum standards.
Right.
So, you would have to change their positions. They got to have opportunities for growth and learning activities. So you still got to get them in and out of that crib.
Sandy, was there something you wanted to say?
Well, I'm just trying to envision how large most infant rooms are. Would it allow for you to be able to do tummy time and stagger that and still be able to social distance?
Did y'all understand what she said?
Is she more concerned with the fact that the staff are actually going to have to pick the babies up? Or is she worried about positioning them around the room?
Yeah, so talk about social distancing, we want to try that 6 feet, and I understand the infant rooms are kind of small. Okay, and I was trying to say developmentally, what do they need throughout the day? And I was thinking about tummy time, and is there a way to do that and stagger it? Because of course you don't want them in their beds all day or their cribs.
I mean, as far as minimum standards, they're welcome to stagger it or whatever they need to do. But children have to have time out of their cribs daily, and they have to have learning and growth activities daily. But they can stagger it. But a child can't be left in a crib all day long. That's not, I mean, we could lose, children can, I know we've got to worry, about the spreading, but also children's development is important as well. And you can lose valuable months that you can't gain back if children are just left in their cribs.
Question. So are we to social distance 6 feet of the children throughout the center?
I guess that's a question for her.
The guidance is that social distance is recommended at 6 feet apart.
Could y'all hear?
The answer is yes.
Sandy, was the answer yes?
The answer was yes.
Okay. Are we able to have sanitizer visibly available?
With minimum standards on that, I assume we're talking about hand sanitizer. I'm not sure if we're talking about sanitizer like cleaning product, or we talking about cleaning products have to be stored under lock and key when they're not in use. So if you're not cleaning something, then you have to lock it away. Hand sanitizer, first of all, you've got to have written permission from a parent on the medication form to even use hand sanitizer. Hand sanitizer, because it is it has alcohol in it. Some children have allergic reactions to hand sanitizer, so you would have to have permission from parents to use it. And then when it's not in use, you can't just leave it out, because there is a risk of children getting that in, swallowing and ingesting that as well, because it's highly the alcohol content in it, which makes it dry quick on your hands, is highly toxic, and you can get alcohol poisoning from that. So it would have to be under lock and key when not in use.
Okay.
I have a question about the hand sanitizer. They just came in and put hand sanitizer on the wall at adult level. Will we need to take those down?
To meet minimum standards, it's got to be under lock and key when not in use. I'm sorry about that, but
No, it's fine.
that's standard. It's just we've had a lot of kids that know about hand sanitizer, especially our school age kids, and they're actually trying to ingest it to get high off of it. Because I've been told over the years, 1 shot of hand sanitizer is like 2 shots of liquor. So, I mean, kids know that. I mean, kids know, especially our school age kids know, and so it's just not safe practice to have it out. Yeah, when it's not in use.
Okay, question. Are there any liability protection from any lawsuit related to COVID?
What'd you say? I'm sorry, I missed the question. Can you repeat?
Okay. Are there any liability protection from any lawsuit relating to COVID?
That is not a question that I can answer. That is a question that I would have to refer you to legal representation to answer. So you would have to refer to your legal person and get that kind of answer. That is a legal question, and I can't give you an answer to that one.
Okay.
I think that's where that waiver would come in, if you wanted to do a waiver for,
Right. And again, I would check with someone. I'm not even sure what a waiver really does as far as your liability. I would check with someone that's an expertise in that field as far as liability issues and check with them.
Okay, another question. So if the answer to that question is 6 feet, how can you still have your license capacity throughout your center? And that was the question about social distancing at 6 feet.
As far as licensing, you again, remember, we're not enforcing the 6 feet of space. That is not a minimum standard requirement. So it has no impact for us at all on your license space. So if you're licensed for 100, then you're still licensed for 100. Right.
Okay. Let's move on. How long does staff wear masks before changing it?
That's going to be a health department question.
I don't do these guidelines, the CDC, looking at the lines upon personal protective equipment, and I don't see that in black and white. I've also gone online trying to see if there were any other recommendations. Sometimes they're even saying that you need to change PPE between the screenings that you do when the children come into the facility. And these gloves and masks are hard to find. So I don't have an answer for that, but I would recommend that you not And lack of guidance right now, I would say for when it's physically dirty or maybe 1 in the morning and 1 in the afternoon. I will try to get you something for sure on that. That's a good question.
Should facilities provide temperature checking for teachers, parents, and children?
Yeah, I think that's a good idea. We're doing it at Public Health. Every morning we have to get our temp check. And that's just a good way of hopefully excluding somebody from coming in that could transmit COVID. But I don't know how many of the facilities might have the touchless temp thermometers. So, but it is good to screen, and I know that in facilities, y'all are screening them, making sure that they're look like they're feeling well and that their activity level is the same, their appetite throughout the day. But I don't see where it's written you have to, but I think for children and teachers, it would be a good idea.
How do we find gloves, Lysol, masks, etc.?
Gosh, if I had the answer to that, I promise you, I am working on it because I knew this question was going to come up.
I ordered some gloves, some masks, and throwaway masks from Amazon. And it may take a little while to get here, but Amazon's always an option. Or, you know, we ordered our hand sanitizer from Cintas, and he was here like a day.
Right. When our office needed some gloves, we found some gloves at beauty salons, places that sell beauty supplies. And then we found some also at like an AutoZone or somewhere like that, I guess for people to use for oil changes. So we found them inside kind of some places, I guess, where people don't often think to look when we were getting some for our staff. And that's the two places we were able to locate some from. So sometimes you got to kind of think outside the box where they might have some gloves that people aren't necessarily always going to first choice.
This is Patricia Chapman from Precious Vessels in Talladega. I have a contact Alabama Paper and Supply. I want to say it's out of Goodwater. I'm actually riding right now, so I don't have its phone number, but you could possibly Google that. And we have gotten the disposable masks, gloves, and disinfectant spray.
Go ahead, Miss Angela Holt.
Yes, I've gotten them from Dermatech Direct before. You can go online and order it, or I have the phone number for them too, the gloves. And I have gotten some sanitizing wipes from them too. And the number is 1-800-992-8987.
Angie Bowen stated www.nation.com will ship directly to you. They are in stock. Tracy Harris said maskbyweekly.com come from US with reasonable delivery time. Just all of these are in your group chat if you want to look back at that, and you can see where it has been posted. Okay. What are the legalities for owners if a staff or child becomes sick, if any? I'm not sure if you all can answer that, but what are the legalities for owners if a child or staff becomes sick?
Again, I'm not able to answer that. I would just refer if you have an attorney that advises you just to talk with your an attorney. Possibly another place would be maybe talk with, if you have an insurance company that you have your daycare insurance through, talk with them. They may have some information about your legality as well.
Could I ask the health department what their stance is on that? What should we be looking to do? If an employee has it, obviously they're going to be ill.
Right, that's the benefit of being able to screen first thing in the morning. Is to be able to find if potentially there is someone who's sick. And you know what's really scary about this COVID-19 is really about the asymptomatic carriers, and that's very frightening. So taking pictures as they come into work and as the children come into your facility would be a really good idea. It's one of the few things that we can do to try to guard off maybe the contagious COVID. So is there another piece of that question that I missed?
I don't think so.
Okay, and then, you know, again, the tricky part is that they can shed the virus 2 to 4 days before they become sick if they are symptomatic. So we are planning to have our PPE that we're working on it right now, so that when we do CPR and first aid, we hope to be able to do the temperatures and supply the face mask and the gloves. You just can't be too careful.
Okay, someone has asked, my classroom for after school has 20 capacity, but not with 6-foot social distancing. How do I allow kids to come in?
They said their classroom capacity is 20.
But not with the social distancing.
Well, again, like I've said numerous times, my staff can only enforce minimum standards. So as long as there wasn't more than 20 in the room, if the room measures for 20, as long as there's not more than 20 in the room, then that would not be a licensing violation.
But would it be a health department violation?
I'm so sorry. Please repeat the question.
If a facility has 20 people in the classroom that aren't really maintaining the 6 feet of distancing, is that a public health and safety violation?
Well, that's not very regulatory. I don't know that it can be a violation. Part of the state health order, but at any given moment, you could have somebody 5 feet apart from each other. You know, just as you move by and you circulate within your facility, it could happen. I don't see where, I guess it could be a violation if we were regulatory, but we're not.
So Sandy, you're saying they're not regulations, they're just guidelines. Is that correct?
I just said it's the state health officer's order. So I think, and I heard Dr. Harris actually say that this is going to be difficult with young children. But as far as one of your nurse consultants coming in and saying, yeah, they'll fuss and try to help you find additional ways to do it. But as far I just would try to do my capacity at where you could maintain the
Someone just chimed in that it's an order.
It is an order. And you know, Valerie, did I send you a copy of that?
I know you sent, I'm not sure which articles you sent, but they are online and also we can send those out. Yes, ma'am.
Okay. Here's the state health order.
Are there any other questions? Let me check real quick. Okay, we have put online the CDC interim guidance for child care, the CDC parents checklist, the COVID, what is it? Guidelines for daycare facilities, and Reopening America Cleaning Disinfection Decision Tool. So all of those are online and available. Okay, statement from a, that has been listed, then that's where the problem will be for the providers' lawsuits could come because we didn't follow the order. Okay. So any more guidelines on that, Sandy?
Yes, on the state health order, they're asking if there were any further guidelines.
Yeah, I think it would be a good idea for us to, Valerie, for you and I to take a look at it. Maybe we can give future guidance. I don't know how specific they get about child care. There's a little bit in there, but we will review that and let y'all know.
I have another statement. The state has updated the number of children allowed in the classrooms to no restrictions. We are planning on following DHR guidelines. Should we be doing something different?
For us in licensing, that again, and I hate to keep repeating myself, but that's the only thing my staff can enforce are minimum standards. So that's the only thing that we will ever write on a deficiency report would be something that's a minimum standard requirement if the center fails to follow that. But other than that, we won't write anything else.
Okay. Any other questions about that? Okay. Should gloves be placed in the regular trash can?
The only thing, I mean, as far as us, if it's gloves used for like diaper cleaning, yes, that's just your regular trash can. If we're talking gloves that we use for that other thing, biohazards, they have to be stored in a different manner. And I'm sorry, somebody's looking that up for me. But as far as like diaper changing gloves, we don't have anything other than they're stored in a covered trash can, with a lid. But for the biohazards, the guidelines on that would have to be followed. And I'm trying to say what it says about, I don't see gloves. Right. But as long as, like I said, they're following the minimum standards on the glove, we wouldn't have anything different we would be enforcing on gloves than what we already have been enforcing on gloves.
Sandy has something she would like to share with y'all regarding the trash can and the gloves. Sandy, if you want to go ahead and say it.
Well, just basically we'll continue to go by the same guidelines that you have with the trash can where it's not accessible to children. We don't have anything additional on that right now, if that is the question.
That was the question.
Okay, good.
What are some effective cleaning solutions for COVID-19?
Okay, one of those handouts that I sent to Sabrina will give you additional information about what is effective. And you know, the other challenge that y'all have is that you want to be sure that whatever you're cleaning with is going to be safe. So that's why I included that handout that I sent to Sabrina. What have y'all been cleaning with?
I think that was a question for the providers on what they've been cleaning with.
We just use Lysol, the concentrated Lysol. We dilute it and use it in the classrooms on toys and surfaces.
My name is Paula, and we have not reopened our center yet, but we will be using the Clorox water solution to clean our toys in our center with.
Okay. And y'all review those documents as far as disinfecting or sanitizing. I think that'll come in handy. And if those are definitely effective at sanitizing. Anybody else use anything different? Okay.
Should all toys be accessible at all times?
As far as minimum standards, they have to have the equipment that is required out, but most providers have much more than what's required. So you could rotate that in and out. I know I was on a call last week where someone gave some ideas, a provider, on what they had been doing. Like they had taken for instance, let's say you have a container of blocks, and they've been bagging those blocks into smaller bags so that each person could, you know, that wanted to play with the blocks, instead of sharing the one big container, they would go up and get a smaller bag of them. And then when they turned them back in, they would just give them to the teacher, and then the teacher could disinfect them or something like that. But you would be still required to have out the required equipment that's required according to the minimum standard.
Okay. Are there any other questions that anyone else has?
Hold on one second. The health department's going to share something.
Okay.
All right. Sandy had something she wants to share. Sandy, they can hear you now.
Okay, all right.
We can't hear her.
You can't hear her?
No.
Oh, I'm sorry, they can't hear you.
Sandy, you're going to have to speak fairly loud.
Okay. Now here, can you hear that?
Yes.
Can you hear now?
Yes.
Okay.
I'm so sorry for this, y'all. It's got CDC has that handout has a really good section on cleaning and sanitizing toys. And I would go by that, because when we're looking at cleaners in the daycare setting, we want to always be sure if we're sanitizing that it's an EPA registered disinfectant. It's also got a little bit on cleaning and disinfecting bedding. I think a lot of your questions will be answered in here, but if you read it and you have questions, call me.
Okay.
Okay, well, can I still talk?
Yes, go ahead, Sandy. You just speak
Okay,
up.
and there's also on there is some guidance about social distancing strategies. And these are going to be specific to the child care setting. So I think that it will be helpful. If they're talking about, postponing any events, that could be, I know that's hard, but it's even harder to social distance in that situation. They're talking about staggering arrival and drop-off times. Those are just a few things that are going to be in this document when you review it. Any questions?
No, Sandy, I think that's it.
Are there any other questions or concerns at this time that you may need to ask from anyone?
I just wanted to ask the lady that's doing the subsidy, what's the projected date of when you think that we need to start, when they'll open up sending in corrections and stuff?
I'm sorry. Can you all hear me?
Yes.
Okay. As far as in corrections, we're not going to, it is a case-by-case basis of what corrections we will be doing at that time. Right now, we don't see a need. There shouldn't be any corrections at all that is needed unless they're like children that are new, that are not on your system, that's, new to you that you hadn't been paid for. But as far as in the children that's already there, there shouldn't be any need for a correction. If you pay close attention to your web portals, you'll see a child that has been swiped every day, or if the child has been swiped more than 25 hours, you'll get paid full-time pay for them. If a child has been swiped at least a minute, you'll get part-time pay for them regardless. So, but again, that'll be a case-by-case basis. I encourage you to talk to your analyst before you send anything up that they'll end up rejecting or denying, so that you can get a clear understanding of why or what you should be looking at is regarding your payments.
I just had some situations with some kids that when their parent got approved, they thought they had to go ahead and pick a daycare, and then they picked a daycare, and then they never entered that daycare. And they started with us because the original one that the worker had on pick, they didn't call first, and those centers didn't have spots anyway. So like they've been with us all along, like before COVID started, but the transfer papers hadn't got done, and she couldn't go to the center that was originally picked to have it signed by the owner because of all the closures. So I'm just dealing with several situations like that.
And as long as it's before the COVID, you can send those adjustments in now.
Okay.
They won't be paid, but they will be processed.
Okay.
But now, if it's something prior to COVID, March 16th, then that's going to be on a case-by-case basis.
Okay. Thank you.
Any other questions? Okay. That was all of the questions that we had at this time. So if anyone has anything that they need to ask, you may do so at this moment. Okay, so I guess we're all good. We're ready to open back up and get the new norm started. Okay.
The only class I have a whole lot of kids in is my preschool one.
Okay. Well, I just want to thank everyone. Okay, there was one last thing. Can you go over rules for staff to wear a mask again, please?
Sandy, you can go
That's
ahead.
in the CDC guidelines, is that staff, can y'all hear me?
Yes.
That staff wear masks we're gonna be fine, that is gonna be in that CDC guidance that you're gonna have. And because you're protecting the children and you're protecting yourself when you have that barrier. Now, if you could have children that are sent to your facility with masks, I think that's something you're going to need to begin to think about, because of course we never ever put a mask on a child under 2. Okay. And this is the statement that they say. And so they're saying, if social distancing or barrier partition control cannot be implemented during training, personal protective equipment can be used within 6 feet of a child. However, reliance on the PPE alone is less effective control and more difficult to implement. And there's going to be more opportunities that you're going to want to wash your hands and the child's hands too. So when you read this, you're probably going to have even more questions. And we can talk about those too, because this is new for all of us.
And this is the way the order read that passed on, that was effective May 23rd at 5 p.m. It says facial coverings. Each employee shall wear a mask or other facial covering that covers his or her nostrils and mouth at all times while in regular interaction with students or guests. And so that's how it reads in the actual order.
Okay, any other questions before we close this out?
Hey, Sandy, do you want to mention the CPR training extensions as far as certifications?
Hold on, Candace. They walked out of the room. Here they are back.
Okay, Sandy has something she would like to discuss with you about the CPR credentialing and extensions. Sandy, you can go ahead.
Okay. We're having a lot of questions, and we've got a lot of demands right now for dark birthdays. One of the what we have been able to work with our ETSI, our credentialing facility, and they are allowing us to do an extension, a 120-day extension from the original expiration date if it is between March 1 and June 30. So right now we're going back to 2018 and trying to identify who would be eligible, get those to our consultant. We'll be calling the facility to be able to see if those employees still work there. And the ones that qualify are still employed with your facility, we will issue that extension certificate. Kind of time consuming right now going through those rosters from 2 years ago, but we're making progress. And we'll get that to you as soon as we can. Might take a little bit of pressure off of you.
So anybody that was registered in 2018 will get a extension?
No. Anyone who got their certificate in March 1 through June 30 of 2018 will be qualified for the extension.
Okay. I gotta check mine.
Yeah, I wish it was for the whole year, but and when we come in and we do CPR, it will be without resuscitation. We'll not be putting your mouth on the mannequin. So that's another layer of being safe as well. Any questions?
Anyone else?
And for licensing, as long as you, if your card was expired during that time that she stated, as long as you have this certificate to go along with the card saying that it was extended, you would be in compliance.
One more thing I thought of for the state rep. What about if our license comes due? Like I've got one of my centers coming up due in June or July. Is that process going to stay the same, or how are those license dates going to be extended till you get back in the building, or how's that work?
First of all, you have to make a timely application 30 days prior to the expiration of the license, and that allows you to continue to operate legally. But we are starting back. We are doing our renewals and our annual visits now. We didn't for a period of time, but for about 2 weeks now, we've started back. So we will be doing those visits.
Okay, so summer should pretty much be on target then.
Yes. Yeah.
Okay, good.
We're maybe a little bit behind because we've got to catch up some we missed during March and April and early May. But yes, main thing is that you send your paperwork in timely so that you continue to operate legally.
Thank you.
Mm-hmm.
Any other questions?
Hey, Sandy. Sandy, you can speak now. They can hear you. Sandy is going to speak.
So sorry. I was just saying that we really feel strongly that working through the Child Care Resource Centers is going to be our best bet of getting as many facilities staff certified as we possibly can in the quickest amount of time. Any questions?
Okay, there are no more questions in the group chat. I do not see anyone with any other questions, and I just want to take this opportunity to thank everyone from DHR that came on to answer questions. Thank you so much. Candace for representing subsidy, thank you for being a part. Also Sandy via phone, thank you for taking this opportunity to be here to answer questions. And to all of you who are on the front line, taking care of our most precious vessels, we thank you, we appreciate you, and just want you to know that Child Care Central Talladega, Child Care Central Huntsville, we are here. There is something that we can do to meet your needs, to make this transition to the new norm not such a hardship. Please reach out to us. We are available. We are providing trainings online virtually and also through our e-learning, but we are also setting up module training up until we can get back to face-to-face. So thank you all for all that you do and for taking care of our precious vessels. Are there anything else before we close the session out? And just want to remind you, if you came on through our e-learning, please take the preview and review to receive your certificate for the day. And we thank you so much, and just check out the handouts. I do have the email of those that have put your emails in the group chat for the handouts. So I will be sending those to you shortly.
Thank you.
Thank you, everyone, and you all have a wonderful day. Bye-bye.
You too. Take care, everyone. Good luck at your centers.
Yes.
Hey, Sandy, that's it. I'm so sorry that I wasn't able to make it more smooth.